Assalamu alaikum warahmatullahi wabarakatuh. I am Dr. Ahmed. Let's talk about how to examine the afferent visual system. I mean here the optic nerve function. So the first thing in this assessment is to evaluate the visual acuity. How to do this? We can do this by doing the refraction. So we can do refraction to all patients. After we doing the refraction to the patient, we need to use the pinhole to see if there is an improvement in the visual acuity or not. So improvement in visual acuity with pinhole indicates that there is a refractive or media cause of the decreased vision. We need also to assess the near vision by bright light, because improved near vision with reading glasses and bright light indicates that there are causes of decreased vision, like a refractive causes of a cataract. It is the visual acuity chart, Billy-Lovey chart, for evaluation of the visual acuity. Color vision is important to be assessed because the most optic neuropathies produce a loss of color perception relative to visual acuity. So it is very important to remember to test each eye separately and to test the color vision before testing the pupils, because sometimes the bright light can produce transient color desaturation. Okay, color vision, how we assess, how we can test the color vision. There are many tools we can use it in our clinic. The most famous thing is the Ishihara color plates. This tests the green-red color deficiency. Also, we have to assess each eye separately, and the number of the corrected identified plates is recorded. If the patients don't see the control plate, it is pointless to test the remainder of the plates. This is the famous Ishihara book, and the 12 blades, which is the first blade in the book, it is recognizable to most of the patients. Also, we can assess the color vision by using the Francois panel D15 or Francois Manswell 100. This tests the blue, green, red color anomalies. Also, we can evaluate the color comparison between each eye. How we can do this? Simply, we can ask the patient to determine the amount of red color saturation by using the Mydriatic bottle red cap. We also examine each eye separately. The pupillary testing evaluation should be performed to every patient. There are many parameters have to be assessed during pupil testing, including the size and regularity of the pupils, presence of anisocoria, relative afferent pupillary defect, response to light and near. Both pupils are constricted when the light is directed into one eye. So here, let me show the pointer. Here we use the strong light torch to the left eye. So when we focus the light to the left eye here, the both pupils are constricted in both sides equally, right and left. After we change the pen light from the left to right, if you notice the size here of the pupil, it is not constricted, it is dilated. So here, left eye, the pupil is constricted. When we change to the right eye, it is dilated. And here, after we swing to the left side, it is constricted also. So there is here a problem in the right eye, and there is a right relative afferent pupillary defect. And later we can explain this and talk about the causes of these scenarios. A mislar grid consists of a central dot for fixation and surrounded by grid pattern. Here we examine also every eye separately. The patient is instructed to look only to the central dot and to Robert or draw if he wants, if he see any scotomas or any alterations of the grid. The defects here, it may be due to a retinal cause like macular disease or a neuroophthalmic causes. Presence of metamorphopsia, I mean that the straight lines appear curved, is indication for a retinal and not optic nerve abnormalities. And we have also many types of amislar grid. The first one is the famous one, and second one is the red. Let's back to the last slide. We find it is useful to use the red grid on the black page as the first test, because some patients with subtle optic neuropathies may have normal white on black amislar but abnormal red on black amislar. So I recommend to start with the red one before we use the classic white grid. So sometimes the patients has problem here, it can be evaluated before using the white blades. Patients with optic neuritis and optic neuropathies have a poor contrast sensitivity. Almost they have a poor contrast sensitivity. And we can also use the Billy-Robson contrast sensitivity chart, which consists of 16 triplets of letter that gradually decrease in contrast. The normal response here is to identify 14 of the 16 triplets, and we record this to HI. We can also evaluate the brightness comparison. Simple comparison of brightness sensitivity between the two eyes is tested in every suspected optic nerve neuropathy. We use a good light and we shine it directly to each eye separately also, and we ask the patient to fixate the light. This light source is held about 30 centimeters from the patient's eye in the center of the visual axis, and we ask the patient if there is abnormal in brightness between two eyes. Photo stress recovery test. Also, it is useful to evaluate and differentiate between the maculopathy and the optic neuropathy. The principle here is that there is a recovery of the retinal sensitivity following the exposure to the bright light. It is based on the regeneration of the visual pigments that were bleached during the exposure to the light. So, if there is a delay in this process, it is mostly due to a problem or disease in the photoreceptors itself or the adjacent retinal pigment epithelium. So, it is not independent to the neural pathway. Also, this test is performed to HI, and we record the visual acuity in HI. Here the patient looks directly to the light source, which is held about 2 to 3 centimeters for 10 seconds, and we record the time taken for return of the visual acuity within one line of the best corrected visual acuity, which is recorded before the test. The most normal patients will have a recovery time of less than 13 seconds, and the recovery times between eyes is within 10 seconds. It is useful to evaluate the macular disease. Thank you for your attention. I hope it was clear to you, and inshallah, if there is or there are any recommendations or any questions, you can directly ask me, and I will send my phone number and the email to all you. Thank you and see you again.